Welcome back. It's Healthy Tuesday, and joining us on the show to talk about health-related matters is a pediatric surgeon and the incumbent Chief Medical Director, Lagos University Teaching Hospital, LUTH, Professor Christopher Olusegun. He will be speaking on issues that centers on LUTH at 60. Your ability to access medical care, complaints, latest innovations, reducing medical tourism, eliminating maldiagnosis, maldiagnosis, checking corruption among staff, and others. You can join the show by calling on 081-270-53687 or Twitter us at TVC Connect. Good morning, Professor.
Very good morning to you, too. How are you doing?
I'm doing amazing. So today we are talking about LUTH at 60.
Yes, we are.
Yes.
LUTH is celebrating its 60th year anniversary. Started on the 9th of this month. 60 years ago, on the 9th of this month, the first patient was admitted into LUTH. That's what we are celebrating today. All the good things that have happened in those 60 years. Yes.
Okay. So I would like to start by asking you, how have you progressed from the time you started 60 years ago till now in terms of the sort of care that you give to patients who come into LUTH?
I must say that, you see, by the time LUTH was starting, there was only one teaching hospital in Nigeria. That was the University College Hospital in Ibadan, UCH, which had been established in 1948. Following the reports of the Ashby Commission, there was need to establish 3 more teaching hospitals, along with their corresponding universities. The Ahmadu Bello University Teaching Hospital in Zaria, the University of Nigeria Teaching Hospital in Enugu, and also the Lagos University Teaching Hospital as the teaching hospital for the University of Lagos, which was established at that time. It's been a steady march in progress ever since. Starting with nothing on ground, this hospital evolved into a household name in Nigeria, a big brand, and many lives have been saved with many firsts. This hospital established the first endoscopy unit, which was done by Professor Akinade Shola and his surgical team in the whole of West Africa. This hospital established the first radiation biology center to treat cancers. Professor Kofi Duncan is still alive. The first dialysis center in West Africa was established in this hospital. And any dentist in Nigeria was either trained by or trained by somebody who trained in LUTH, because we were the first to establish the first department of dentistry in the whole of Nigeria. So many firsts like that. The hospital has given a good account of itself in service, in training, and also in research, which have remained the 3 mandates for which it was established. Thank you.
Okay, sir.
So, Prof, we would like to know, in the 60 years of LUTH's existence, what would you say are let me just give a number, 3 things that you're most proud of today, and then 3 things you wish you could do better or could be done better in 60 years?
3 each?
Yes, please. Or 1 each.
The hospital has produced thousands upon thousands of skilled manpower. Our trainees, our graduates, are much sought after all over the world. You don't hear anybody complain about Nigerian doctors, and anywhere they go, they excel. That nurses, doctors, pharmacists, laboratory specialists, and you name it, they all excel wherever they go. That is a testimony to the degree of training that they receive here. Another one has been the upsurge of infrastructural renaissance that has happened in the hospital in the past decade. We have so many things to be proud of. We have the best cancer center in the whole of West Africa, in fact, sub-Saharan Africa, north of South Africa. we are competent. We deliver world-class cancer care at a fraction of what you will get it anywhere else in the world, even excluding the cost of airfare and hotel fare. And we have so many, that's another one. And the third thing I'm very happy about is the role the hospital played in assisting both the federal government and the Lagos state government during the last COVID-19 pandemic. I won't say the last, which is still ongoing. Yeah. So these are great things that the hospital has meaningfully contributed to not only Nigeria, but to the world. Yeah. And we can stand tall and hold our head high and say, yes, LUTH has been a part of those things. Now, you also ask about things that I would rather wish to be done better. I would wish, for example, that all Nigerians are well covered under a well-organized national health insurance scheme by now. People say we still have less than 10% of Nigerians covered. And as such, healthcare financing and who pays for good care that we can provide is a problem. Without money, you cannot run, even if you can produce the best care. If the clientele cannot pay for it, how do you sustain it? That's one thing. And it's one thing Nigeria will have to grapple with and definitely decide on who. The question is who will finance the good healthcare Nigerians receive from hospitals such as this. That is one thing. Another thing I would rather not have had were the spate of incessant strike actions that dominated the past several years, until maybe, let me say, about 7-8 years ago, when in our sector, the healthcare sector, government put its foot down and said, if you don't work, you don't get paid, and that reverberated down the rank and file. And as such, we've had a lot of peace in the system, which has allowed growth. We could have done without all those strike actions, when at a point everybody wanted to see who could cause the most number of strike actions. A third one would be the unsavory interdisciplinary rivalries between associations in the healthcare sector. We know the historical antecedent and all that. It didn't go well for healthcare for a long time. These were things that, however, have now been put to rest, or let me largely put to rest. We could do better, but these are some of the things one could have done without.
Thank you, Prof. Well explained. Let me get in more questions.
Okay, so Prof, congratulations on the 60th.
Thank you. Thank you.
LUTH as an institution cannot just, be without challenges. I know that the institution was built for a smaller population, and since the population has exceeded that facility, so constantly you have patients coming and complaining of bed spaces. Some of these issues are unattended. I had the experience of turning back patients. There's also the mismanagement of certain areas of the operations of the hospital, where your staff, some of them, would require monies before they even allow people into the gates because of bed spaces. Again, there's corruption. There are so many issues. How many of these are, to your knowledge, and how have you been tackling them, sir?
Thank you very much. I think the first part of your comment is well taken, that in 1962, when LUTH was established, it was planned for the small population of Lagos. About 20-something years ago, the population of Lagos was just about 2 million. You can imagine that the population of Lagos has done more than 10 times that since. And as such, the same facilities established 60 years ago cannot cope any longer. We now have 2 teaching hospitals in Lagos. In comparison, let's take what happens in Abidjan, which has a population of about 8 million, has 3 teaching hospitals, and they are building more. So you can compare that with a population of over 20 million that has just 2 teaching hospitals. And until recently, the primary and the secondary tiers of healthcare were virtually not doing their own heavy lifting, meaning every complaint, headache, catarrh, cough, diarrhea, come to this tertiary institution. So that has been a strain on the services, on the facilities, on the manpower. So that we're happy a lot of newer renewal and rehabilitations are going on in LUTH as I speak, and this is to respond meaningfully to the demand that is placed on our shoulders. For example, our accident and emergency building is also used for the outpatient as outpatient clinic, and over time the complaint is that, oh, no space in LUTH emergency. Yes, that is partially true, because no matter how big a facility is, if it's not used properly by the end users, it will become overwhelmed. You can go to DC General Hospital, DC General in Washington, DC, and wait 3 hours to see a doctor. And when Nigerians experience this, that's when they write up and say, oh, we didn't know this also happens abroad. But the peculiar problems in Nigeria include the fact that patients cannot even pay for what they are consuming, for the services you are rendering. Somebody comes in, you admit him, you're supposed to spend 6 to 12 hours or so in the emergency room, but you finish treating and he cannot even move to the next stage. He cannot pay to be admitted. He cannot go for surgery because he sends somebody to Kokomaki to go bring money, and that person doesn't come back for the next 4 days. So he's blocking a bed. And that happens if you multiply that by 30, 40 beds, then the next patient that comes in, the conveyor belt has not moved. So that's been a problem, which goes back to what I alluded to earlier. We must find out how we will sort out payment for good services that we're rendering. Prof. So that is that. What we are doing now is that, yes. Okay. Let me just make this point. Okay, finish. What we are doing now is that we have appealed to government, and government in its wisdom has granted us good funding to move the whole of the outpatient clinic from where it used to be across the road, so that we will have about 256 rooms for outpatient alone, and the building that we're using for emergency now will be used totally only for emergency. So this will expand our services a lot very soon. That's the point I was going to make. Okay, thank you so much, Prof. But I want to ask this question. We know about medical tourism. One side, we have the brain drain, where doctors are resigning and going for greener pastures outside the country. On the other hand, we have most of our leaders not using the facilities we have. So with every innovation that LUTH is doing, why do we still not have our leaders and politicians patronize a hospital like LUTH in Nigeria? I may not be able to speak for our leaders, but I may just make conjectures. The choice of where you go for healthcare depends on a number of factors. Don't forget that hospitals are a combination of what you call hotel facilities, where you want to be pampered and you want to be given prompt attention, for which you will pay, and also the treatment facility, medical treatment. We combine this in hospitals like LUTH. We have gone through several years of zero growth budgets, underfunding, conflicting policies and things like that, which led to us getting left behind. I'm not talking only of LUTH, Nigerian medical services in Nigeria. We got left behind while other countries and other climes moved ahead technology-wise. It's only in the recent years when governments have renewed the desire to fund teaching hospitals like LUTH and rehabilitate them that confidence is returning. And this, as quite a number of government officers are patronizing hospitals like LUTH. I must say that. So that impression is wrong that they are not coming. They are beginning to come. I mean, who want to go and spend $32,000 abroad when you can get it for less than $3,000-4,000 in Nigeria in LUTH, in your own backyard,
money.
and
I
you'll
don't
be
want to
treated by
answer that
your
question,
It's government's
Prof,
money, Prof.
But Prof, I just want to say so.
I say it's government's money. You were asking who would want to spend that amount of money.
So a lot of government officials are coming. I don't know if it will be possible to legislate that nobody should go out of Nigeria. We are not an authoritarian country. So, but what we can do is to promote and continue to improve our services and advertise them and use mediums like yours to advertise what we do, showcase what we are doing and what we are doing well. And that's the only way the confidence will return. And then more people will patronize us and spend their money here in Nigeria. And that's the way it is. Thank you.
Okay, Prof, so, this job that we do here, every day we get to read some really heartbreaking stories as relates to our health sector. One of the ones that keeps reoccurring that's so heartbreaking is when someone is involved in an accident or has been shot by an armed robber and that patient is taken to the hospital. I would like to know what LUTH's stance is on someone who has been brought to the emergency, either from a road accident, bleeding from a gunshot wound, with no relative or anyone that can stand for them at the time. What is the policy on LUTH to treat that person or send them away?
Thank you. The teaching hospital was built by Nigeria for Nigerians. We are all human beings too. And apart from that, the federal government has a policy for all its hospitals. Any hospital in Nigeria, whether private or public, is not allowed to reject a human being brought for emergency treatment. That goes without saying. Whether you are a king or a pauper, you have money, you don't, we cannot reject you for an emergency. We will admit you, we will give you the best care we can to revive that person and stabilize. Please, those words are very important. If he's bleeding, we stop it. If he's cold, we warm him up. If he's having a fever, we bring it down. If he's unconscious, we find out the reason why, investigate, and quickly bring that person to consciousness. If he's diabetic, we maintain, and we do all that to revive. Then we maintain life. That is the stabilization. We maintain life so that it doesn't go down or become worse. But after that, within the first 48 hours, 24, 48 hours, I will not say this too so openly. Let me be careful and choose my words very well. We will revive you and stabilize that person. If it's a critical thing, we cannot stop and fold our hands and say, okay, go and bring money before we treat you, we do the next things. We will encourage that whoever that person is to pay, if they can, if they are conscious, we will still continue treating. But we will try and get our money subsequently. I think that's all I'm allowed to say, because while saying all that, you cannot say everything will be free ad infinitum. Otherwise, the culture in Nigeria is, even the richest man will say he cannot pay. So we don't reject anybody. That's one. Second thing is that I'm happy. Government has now is putting in place now some funds that will be able to take care of such persons, and it's being worked out so that hospitals like ours will get paid for work done. Okay? It is being put together by government so that nobody should perish because they don't have to.
I agree with you, Prof, but we know that LUTH as an institution also gets a budget. But then
I didn't hear that very well.
You get a budget as an institution from the government, so it's not a private institution run on itself. So money should not be priority. Sir, I want to go back on the issue of management again. How many times and how have you handled the issue of no oxygen? We know when people come to hospitals, you then find out that patients are made to buy certain things the need for care in government hospitals. It happens a lot. You're treating a patient, they run out of fuel, they run out of oxygen, the families are running helter-skelter. These are some reports that, have happened within your institution. Also, how do you deal with some of your high-ranking doctors who are consultants with private hospitals, referring patients out of LUTH to those hospitals? Have you gotten those reports in the past, and how have you dealt with some of them, sir?
Okay. No oxygen. LUTH has an oxygen plant established by a private organization years ago that produces up to 160 cylinders of oxygen a day. Yes. Recently, we as I speak, so that capacity is also being upgraded with funds from government. Mm-hmm. So the issue of no oxygen rarely occurs in LUTH, except there is a breakdown or something. No occupation doesn't occur.
Prof, sorry to interrupt you.
Let me finish that sentence. Okay. However, the oxygen we get from the private PPP must be paid for. Otherwise, we won't be able to get more. So the issue may be a patient who cannot pay. We will find a way around it. We will not deny you of oxygen, but we have enough oxygen. The litmus test of that was during the COVID-19 pandemic, when so many patients had to be admitted at the same time. We managed. Yeah. We even that time, when there was a day we had 48 patients on admission, all of them needed high flow rate oxygen. We supplied it. So LUTH LUTH has oxygen. We're even hoping that by the time the increased capacity comes in, we'll be able to supply other centers with oxygen. That's one thing I would say.
Thank you so much,
The second thing you mentioned something again about doctors that have private practices.
Yes.
And we discourage that with as much force as possible. It's in the statutes that nobody should refer our patients outside. If anybody is reported who does that, they will face the highest level of disciplinary action from the hospital.
Thank you so much, Prof.
If it's brought to the attention of the institution, yes.
Thank you so much for being on the show. I wish we had more time with you. We would have asked a lot of questions, because there are still issues that Nigerians are complaining about, especially when it comes to LUTH, that we didn't have an opportunity to get answers to today. But thank you so much. From time to time, we hope to hear from you on that. We've been speaking to Professor Christopher Olusegun. Thank you, sir. All right, that's all we can take on this segment. When we come back, we move on to other topics. Stay with us.
Stay tuned. Your View will be right back.